The B. Brown Varsifix Safety IV Catheter with passive safety technology. Safe and easy to use, resulting in first stick success. B. Brown's proprietary universal bevel on the Varsifix Safety IV Catheter is a super sharp needle that provides flexibility of insertion angles. The universal bevel creates a V-shaped tricuspid incision, resulting in a flexible pathway for easy and smooth catheter insertion. The result is less tearing and faster healing, greater comfort for clinicians and patients. Varsifix Safety's double flashback technology improves first stick success through quick visualization of both the needle flash and the catheter flash. Here's how the double flashback technology delivers this benefit. Upon insertion, the first flashback of blood, needle flash, is visible in the clear flashback chamber, confirming the needle tip is in the vein. Using the injection port on the catheter hub or using a wing, the catheter is advanced forward off the needle into the vein. As the catheter is advanced, a second flashback, catheter flash, occurs between the catheter and the needle, confirming that the catheter is successfully in the vein. Once the catheter is advanced completely, the needle is withdrawn in a swift, continuous motion. The removable closing cone gives the user the possibility to close off the Varsifix Safety IV catheter with one hand directly after catheter placement.
Gain informed consent for the procedure. Next, prepare your patient by selecting an appropriate arm and placing it on an absorbent sheet. Next, tie your tourniquet approximately 3 to 5 inches above where you plan to insert your cannula. The tourniquet should be tied so that it is easily releasable, like so. Select an appropriate vein. The vein should be as large and as straight as possible. Bend the wrist and pull the skin tight over the knuckle to straighten and anchor the vein. Choose an appropriate entry point. If possible, try to avoid the length of the cannula crossing the joint. Hold the cannula firmly, using your index and middle finger on the wings and your thumb on the back of the cannula to control the needle. Clean the area of skin in a cross-hatched pattern. Insert the tip of the cannula at an acute angle, straighten and advance a few millimeters. Keep the skin tight to anchor the vein. Gently advance the stellate of the cannula. Again, close up. Warn the patient of a sharp scratch on insertion. Observe the first flashback of blood in the chamber of the cannula. Retain the tension of the skin. Observe the second flashback along the tube as you advance. Release the tourniquet if you do not plan to take blood. Securing the cannula with your hand, remove the needle completely and place in the sharp spin. When taking blood, occlude the vein with your middle finger and stabilize the cannula with your thumb or index finger. Attach the adapter and blood bottle to take the blood sample, making sure to stabilize the cannula. Aspirate the blood slowly. Release the tourniquet. Holding the cannula securely again, occlude the vein. Raise the arm to ensure there is no blood loss. Attach the bionector and flush. Gently inject the flush, making sure there is no swellings or pain around the site as you do this. Now secure the cannula using the strips of tape over the wings, making sure you don't obstruct the view of the entry site. Place the rest of the dressing over the cannula, making sure the entry site is visible through the clear window. Don't forget to add your dated label at the side of the dressing. Finally, clip the end of the bionector so that it is neat and secure. Wash your hands and thank the patient, making sure the flush is prescribed and the procedure is documented in the patient's notes.
Superficial veins are displaced easily and need to be stabilized. Use your non-dominant hand to apply traction to the skin distal to the venipuncture site. If the catheter is placed in the dorsum of the hand, grasp the patient's hand with your non-dominant hand, fingers beneath the palm. Pull downward to flex the wrist, and use your thumb to keep the skin taut. If a forearm vein is selected, use your non-dominant hand to encircle the patient's arm. Place your thumb on the skin distal to the venipuncture site and pull down. Regardless of the venipuncture site, always maintain a firm grip on the patient's hand throughout the procedure. With your dominant hand, insert the metal needle bevel up at a 5 to 30 degree angle through the skin and into the vein. The angle used to approach the vein is dependent on the depth of the vein. A lesser angle is required for superficial veins. Do not insert the catheter too deeply, as this risks penetrating the far wall of the vein. When the catheter enters the vein lumen, watch for the initial flashback of blood, which will slowly fill the catheter chamber. Once the metal needle and plastic cannula are in the lumen, lower the catheter so that it is almost parallel to the skin. Hold the end of the catheter with the thumb and index finger of your dominant hand. Maintain tension on the vein and the skin, stabilize the needle, and carefully advance the catheter into the vein. When the catheter has entered the vein lumen completely, remove the tourniquet. To prevent blood loss from the open plastic cannula hub when the metal needle is removed, place direct pressure over the vein proximal to the end of the catheter, and place a gauze pad beneath the cannula hub. Remove the metal needle from the plastic cannula and place it in the sharps container. Never attempt to reinsert the metal needle into the plastic cannula. Doing so may shear off the plastic cannula, releasing it into the bloodstream, resulting in a possible embolus. Make sure that the tourniquet has been released, and confirm that the cannula is patent by flushing it with normal saline. The volume used depends on the size of the vein and the gauge of the catheter. Check that there is no swelling, redness, leakage, or discomfort around the insertion site. Attach the intravenous fluid tubing to the cannula and start the fluid infusion. Ideally, you should secure the cannula with a transparent occlusive dressing placed over the cannula hub. Confirm that the hub of the cannula is clearly visible through the dressing to facilitate monitoring. After securing the cannula with tape, loop the intravenous tubing and secure it away from the insertion site. Looping the tubing may prevent accidental displacement of the cannula, decrease cannula manipulation, and lower the risk of venous contamination or irritation. It is recommended that you write the date of insertion on the dressing to facilitate determining how long the cannula has been in place. To reduce the risk of infection, continue to review the indications for peripheral intravenous catheterization and remove the cannula as soon as possible. Blood might flash back into the chamber if the tip of the needle has entered the lumen, but the cannula has not yet entered the vessel lumen itself. This problem can be avoided by reducing the angle of the catheter and advancing the needle a few more millimeters into the vein. A valve within the vein may prevent advancement of an inserted catheter. If this occurs, hold the cannula hub in place, remove the tourniquet, and connect the intravenous tubing to the cannula. Running fluid into the vein may open the valve and allow the cannula to be completely inserted. Occasionally, it is possible to advance the catheter when it is outside the vein or when the catheter has perforated the vein's opposite wall. Either of these situations can cause pain and swelling at the insertion site because the intravenous fluids are administered into subcutaneous tissue. When this occurs, the cannula should be withdrawn completely and another cannula should be placed